Hi, good afternoon, everybody, and thank you so much for joining us today. Well, I'm going to do a little bit of technical assistance before we get started. On the right-hand side, there is a column that says Go to Webinar Control Panel. I'm hoping that you all can see that. And in that, there is a section that says Questions. What I'd like you to do as technical assistants, if you can put your name in and tell us where you're from, we'd like to know some of the people who are on today's webinar. Our guest today was very, very popular. We had over 300 people, over 309 people registered to attend. And so I was telling her that they're here to listen, so a lot of pressure. But we're very, very excited. So Chip, who's here on the line right now?
We're getting a few people answering right now. We have Brandy from Tallahassee. We have Teresa from Williamsport, Pennsylvania. We have Jerry from Rutgers HIV Prevention, CPSDI in New Brunswick, New Jersey. We have Stephanie from Harrisburg, Pennsylvania. Ryan from Chicago, who says Raniyah is stunning. We have Brian from AIDS Upstate in Greenville, South Carolina. Custermaker Epps from Pensacola. Derek Robinson from Basic NWFL. Daniel Hunter from AIDS Delaware. Tori Green from New York. Kelly with Cass in Iowa. Kristen from Oakland, California. Chris from Public Health Associate in Illinois. So we got people from all over the country chiming in right now.
Yay. Well, thank you all so much for joining us. I have to tell you all a funny story. When we were putting together this webinar, it really came from staff. And I do a regular meeting with the frontline staff. And at the last regular meeting with me, they were telling me, I just think that BAI is the coolest agency in the world. And one of my staff said to me, and they talk to young people unlike you. And, and I thought, well, maybe a lesser queen would feel jealous. I just wanted to bring Raniyah here to see what all the fuss was about and to let her know how much my staff absolutely loves everything that you do. Particularly, they wanted me to say to you how much they appreciate your social media stuff. As someone said to me, they speak in a language that speaks to young people. And that is so important. And so part of what I want my staff to know, and part of what I want everyone to know is that, this is a big job. There are a lot of people and there are a lot of roles. And it's not about BAI versus NMAC. It's about BAI and NMAC. And that we have very, very important things to do. And so I am honored to hold you up and to hold your agency up and to tell you the funny stories about my staff who really do love you. I mean, they really do love you. And sometimes I think we don't acknowledge each other's work enough. And so I also just wanted to take this moment because I know that you had some big shoes to fill and you've been doing an amazing job. And it wasn't just the younger staff, it was also the Black women on my staff. The Black women on my staff feel so empowered by you. And so we are just so honored to have you and the Black AIDS Institute on today. And just for all of the participants, please know this. What we're going to do is that Raniyah will do a quick we'll do an introduction, and then she'll do a PowerPoint presentation. It should last, 15, 20 minutes, and then we'll have about 30 minutes for questions at the end. The way we're going to do questions is that you need to type your question into the question section of the Go to Control Panel, and that's why we had you do it that way. And so without further ado, this is the Executive Director of the Black AIDS Institute, Raniyah Copeland. Thank you for being here.
Paul, thank you so much for the invitation. I think that my staff probably don't feel as good about me as your staff feels about me. So maybe that's what gets to happen when you look when you're not inside of an organization. But I am grateful. I've had a huge amount of support in this role. I am now just a bit over 18 months. I think I'm 19 months into the role of president and CEO at Black AIDS Institute. And if folks know about me or have worked with me, which is very possible with the kind of amount of time that I've been at BAI, I've been there for almost 14 years, maybe it's over 14 years, 13 years now. It's a long time when you can't remember the exact amount of time. But I started at Black AIDS Institute as a training coordinator. And working with HIV organizations, AIDS service organizations, community-based organizations, and really supporting a lot of times the Black staff that worked in these agencies to increase their capacity to be leaders within the organization and leaders really locally and nationally within the field, and have had the experience and really the honor of working with probably folks on the line for a long time. And so then being able to have the privilege of being selected to lead Black AIDS Institute. I'm the first person leading the organization since our founder and longtime CEO, Phil Wilson, who, is a giant in the field, retired. And, it's been an exciting time. It's been a lot. I tease how I have a whole lot of new gray hairs now, but it's been really exciting. Paul, I don't think are giving yourself enough credit, and the support that you've given me and the support that other organizations across the country have given me in me kind of leading the organization and growing in my leadership role. So I'm gonna share my screen because I have some slides. And what I thought I would kind of go through is kind of who is BAI, what do we do, what's kind of been happening. This year has been so different than anybody anticipated. Not anything that we had in our work plan, within our strategic plan. And so we've all had to pivot and change. But I think there's also lots of opportunities that are important to us in all of our mission towards getting towards the end of HIV. A little bit about me, beyond being at BAI for so long. I'm a Southern California native, so I'm from the Southern California area, Pasadena in particular. My parents are actually from the East Coast. They're from Philadelphia and New York, and my parents joined the Nation of Islam before I was born. And they were from kind of an upper middle class East Coast Black family where we could tie the family members who were runaway slaves to our own kind of personal existence. And they were big in the church, founding some of the first Black churches in the East Coast. And so when my parents converted to the Nation of Islam, they got a lot of pushback and even kind of got cut off from pieces of their family. And so they moved to Southern California in hopes of a new start. And from the Nation of Islam, they then converted to Orthodox Islam, kind of that same journey that Malcolm X took. And so, I was raised with values of Black liberation. I was raised with the concept that we can only take care of us, and very clearly knowing that Black people were not free. I also understood the experience of kind of isolation, right? That being different meant that family was cutting us off and not engaging with us. And that kind of shaped who I was. And so, my idea was I'm going to become a doctor, and the way I'm going to give back to Black people is by ensuring that Black people can live long and healthy lives. I went to UC Berkeley for undergrad and majored in public health and African American studies, where I did a lot of research around HIV and saw this huge disparity in Black communities as it relates to HIV. From there, after undergrad, I went to work at Planned Parenthood, and I was doing a postbac program, so taking a couple more classes, some more science classes to apply to medical school. And while I was working there, I was doing HIV testing, I was doing STD testing, counseling, all that kind of stuff. And while I was there is when I tested my first person who was HIV positive. And it was a young Black gay man. And I was so nervous to give the results. And, after I talked to some of my colleagues, went in the room, gave the results, that experience, his response was, so defeated. He was like, I guess I should have expected this was going to happen. That this is my fate in life because I am Black, because I am gay, that HIV is, going to be a part of my life. And for me at that point, that was what I realized, that nobody should have to live like that. That, what kind of world are we living in where, this whole group of people are expecting that they're just going to acquire HIV because of who they are. And then I saw a job for Black AIDS Institute, and I was like, it's my two favorite things, health and Black people, and was stalking the office and driving around the building as I was hoping someone was going to call me for an interview. And been here ever since. But that background of who I am is a part of the kind of drive that I have for Black AIDS Institute, and the way I see our work and how integral it is in helping us and getting us to the end of HIV. So I'll share the PowerPoint, and I think when you kind of see it, you'll see a little bit of, let's see, how do I do this? Just a window. Okay, there we go. Let's see, what am I sharing right now? I think I'm there.
You are.
Yes?
Yep, there.
You see it?
Yeah.
All right. So this is Black AIDS Institute. You can see, our logo. We redesigned our logo. We went through a rebrand. So our first new logo in 20 years. We released it in February. And I want to talk a little bit kind of about who we are. So who is BAI? What's our foundation? The lens that we use in doing our work, and the actual work that we're doing. So our foundation is, what holds us together. Our vision is that we see a world where all Black people are free and flourishing, without HIV and AIDS, free of stigma and shame, and where Black health and well-being are paramount. We're the only uniquely and...
Could you enlarge your screen so that the PowerPoint fills the whole screen? Because we're seeing your two slides at the same time.
Let me see if I can do. Let me see if I can show a screen. How about that? Do you see that? Is that better?
Perfect. Thank you.
Okay. Cool. So we are the only uniquely and unapologetically Black HIV think and do tank in America. So, not only do we think about the things that need to happen, but we actually do them in communities. We're powered by 2 decades of work to end the Black HIV epidemic on the ground in communities, and we're led by people who reflect the issues we prioritize. That's very important to us. We are the communities that we serve. We believe that health justice is racial as social justice, and consequently, we're deeply committed to exposing the systems and roots of oppression, right? So we're not, what we believe is that HIV is not just, that HIV is an outcome of systems of oppression. And if we're really talking about ending HIV, then we have to change the system. HIV doesn't happen in a bubble. HIV disproportionately impacts Black communities, not because we have sex more, we use drugs more, any of those things, right? It's really because of these systems of oppression. We can link it to evolutions of slavery that show up and now manifest in ways in disproportionate impacts of HIV, disproportionate rates of poverty, all of these things that impact the Black community. Our mission is to stop the AIDS epidemic in Black communities, and we do that by engaging and mobilizing Black institutions and individuals to confront HIV. So we are very clearly talking about, and our mission is really about Black folks, right? It's about Black individuals, it's about Black institutions. And within that, because we're talking about Black institutions or Black individuals, we also focus on institutions that serve Black communities, right? So that's organizations, institutions that may not be Black led, they may not have Black leadership even, but they are providing services to Black individuals, and our mission is to engage with them. So who we are, right? Kind of what keeps us together. Maybe this is a little bit of what you're talking about, Paul. I think that, people, one of the things people love about Black AIDS Institute is our ability to be, uniquely and unapologetically Black. And that's very much rooted in our values. And so we have values of Black empowerment. We rely on the strength, struggle, and contributions of Black people to liberate systems, policies, and institutions that profit from and are passive regarding the presence of HIV in the Black community. We are very confident in the talent of Black people, and the ideas and our ability to change the lives of those we serve. Because we are the communities that we serve, we believe very deeply in the core mobilization concept that people who are closest to the problem have the solutions to those problems. We believe in equity. Impact is a huge value for us. It's something that we're constantly striving for. There's significant room for us to improve in this. How do we strive for results in our work and our partnerships? We try and be honest about what's working, what's not. And our commitment to impact is really our commitment to ensuring that the lives of Black people are valued, right? If you believe that Black lives matter, then you have to believe that impact is critically important. We believe in self-determination, our value of self-determination. We're relentless in our pursuit of our organizational mission. I'm sure my staff can testify to this, that our mission is big, and we are not a big organization, but we're relentless in our pursuit of our mission. We define ourselves, we create for ourselves, and we speak for ourselves. And we're not easily discouraged by resistance or slowed progress. And the last value we have is integrity. We're honest with ourselves and each other. We are reliable. We do what's right for and with Black people, even when it's difficult, and particularly when it's difficult. Our love for Black people, our love for ourselves and for our families supersedes challenges, and integrity is important in that. And then we have a lens, right? So how do we kind of stay true to ourselves? For us, we make sure that our decisions, our responses, programming, and messaging are informed by these three contexts. I'll start with the last one, culturally humble healthcare. We believe that ensuring that Black people have the resources to be successful, ensuring that we're giving healthcare to people in a way that's affirming, particularly to Black people, that's affirming, that's including culture, right? That's utilizing and centering Black culture in our healthcare approaches, that we are listening more than speaking in our healthcare services, that we are, like I said, centering kind of our culture in all of these pieces. For us, this is really important. It shows up in our direct service work. And so, BAI is a 20-plus year organization, but 5 years ago, we started providing direct HIV services in Los Angeles. And we thought it was important because we go across the country telling people how to end HIV in their community. But where we're headquartered in Los Angeles, we have this huge epidemic and disproportionate impact, particularly amongst communities of color and specifically in Black communities. And so we started providing direct services 5 years ago. Right now, we're providing HIV testing to over 3,000 people a year. We have a clinical partnership with St. John's Well and Family Child, and really being able to take this effort, this goal, this lens of culturally humble healthcare and actually practice it, learn from it in a clinical setting. The next thing is being unapologetically Black. We are, and if you've been in probably a space with me or in a space with any of our staff, we show up unapologetically Black in kind of everything that we do. That means we ignore the white gaze, right? So we aren't thinking about, and we aren't concerned with the feelings, not the feelings, but how us being pro-Black and speaking about Black people at every every corner, we aren't concerned around how that impacts other people, right? We aren't concerned around what other people are thinking. What our concern always is, what we're always lifting up, is the needs and the feelings of Black people. And then the last thing is really kind of the roots of the problem and the solutions of those problems. That, the inequities that we see in Black America are evidence. We have strong evidence to show that they are linked to slavery. It's linked to anti-Black racism. And so if we're talking about the solution, then we have to also talk about how we got here and what those roots are. This is critical race theory. This is Black Lives Matter, this kind of concept that if Black lives truly matter, then we have to really respond to the systems that need to change. We have to really think about Black liberation and freedom. And when it's expected that 1 in 2 Black gay men are going to acquire HIV within their lifetime, this obviously is not freedom, right? It really brings me back to the experience that brought me into HIV, and doing HIV testing, and delivering my first positive HIV test. And so what is our work? I'm going to try and go through this piece quickly, because I'm excited to kind of go through questions and hear from folks. But we have 4 main areas of work. So we have advocacy and mobilization. I'll talk a little bit about our BTANs, our Black Treatment Advocate Networks, which really are our core vehicle for mobilization. There's Black-centric healthcare, which I talked about, our services and programming in LA. Training capacity building, so doing training capacity building with healthcare organizations, health service organizations, community-based organizations, and then information dissemination. So, and the Black AIDS Institute, every year we release a State of AIDS in Black America report. And that report really kind of has different themes and lays out either concepts, policy recommendations, strategies. One of my favorite reports that we did in the past was Left Behind. And it said if Black America were its own country, how would it compare to other countries in the world? And what we saw is that if Black America were its own country, that we would be, in the top 10 impacted countries across the world. This was before we had a national HIV and AIDS strategy. The U.S. doesn't have a PEPFAR program. And so what does that mean when we have this whole community who is being impacted around HIV, but we don't have a strategy for them, and we're giving millions and billions of dollars to other countries, which is an important thing. We shouldn't stop that. But what should we be doing here in our own backyard as well? So in February, I was really excited to be able to release our latest State of AIDS report in February for National Black HIV and AIDS Awareness Day, to be able to kind of give my spin on what I thought was critically important. And so what we did, our report was called We the People, A Black Plan to End HIV. The year before, Trump released his plan to end HIV. And we were concerned, to say the least, that within the plan, there was not explicit strategies for ending HIV in Black America. And that it felt like a lot of, at least when we read through it, a lot of the strategy was really focused on biomedical tools to end HIV with, the innovation that can come from local jurisdictions that could potentially include things like responding to mass incarceration or homophobia or stigma within their jurisdiction. But, for us, we thought it was really important that we had an explicit plan that talked about ending HIV that encompassed more than just the biomedical strategies that are critically important. But what we know and what we've seen is that if we can give people the biomedical tools, but if we aren't responding to the reasons why they are acquiring HIV at higher rates, why they're not able to achieve viral suppression, then these biomedical tools mean nothing. And what we are seeing now are this widening in disparities. When you look at PrEP usage amongst Black and Latinx folks compared to white people, the disparity is only widening. And so really being able to think of a plan that responsive to the roots of HIV. And to build this report, we did it in a collaborative way. We did 3 town halls across the country, focused in the South. So we were in Natchez, Mississippi, we were in Houston, we were in Montgomery, Alabama, to gather input from community. We did surveys with our BTN members, with people in the HIV workforce, and we brought together an amazing advisory board of some of the smartest Black folks in the HIV field to really kind of help us think through the data that we collected and come up with these 4 recommendations to ending HIV in Black America. And so the first recommendation really was, we have to dismantle anti-Black practices, systems and institutions that endanger the health and well-being of Black people and undermine an effective, equitable response to HIV and Black America. This really is the systems, right? If we're talking about ending HIV, we have to often talk about the systems that fuel our epidemic and really dismantle those systems and ensure that we have an equitable systems that are supporting us getting to the end of HIV. The second recommendation is, dismantling systems is a big job. It's something that we've been trying to do for hundreds of years. And by we, I mean Black people. And maybe we can have a conversation around kind of what that we means. And what we see today, because of Black Lives Matter, because of, I would even argue, because of being able to now see the injustices because people are recording them. But this, it's not different than the stories that we've heard from our aunts and uncles and from our grandparents, or that we've experienced as it relates to police brutality, as it relates to racism in this country. But that's going to take time, right? Being able to dismantle systems is not an overnight effort. So in the interim, we have to make sure that we're providing resources and services that address the fullness, the richness, the potential, and the expertise of Black people to mitigate social and structural factors that worsen health outcomes in Black communities, right? So how do we make sure that HOPWA is up and running in local cities and are effective so Black people have housing? How do we make sure we have substance use programs so that Black people have the resources they need, whether it's needle exchange programs or whatever it might be? How do we make sure that we are developing programming for Black people who are over 50? We know that particularly Black people who are living with HIV, the majority of people who are living with HIV right now in our country are over 50. And so what are the programs that we specifically provide for an aging population? And making sure that we're mitigating these social and structural factors with many of the programs that we in the HIV field currently provide. The third one is healthcare, pretty much. We need to have universal access to high quality, comprehensive, affordable, and I want to emphasize culturally and gender affirming healthcare. That universal access to healthcare doesn't mean that it is the poorer version of healthcare you might get through your employer, but that really that healthcare services need to be high quality. They have to be culturally and gender affirming, so that Black people are able to utilize them. And then the last recommendation is building the capacity and motivation of Black communities to be the change agents for ending HIV. There's no doubt, and when you look at our values around Black empowerment, we believe that Black people can and Black people want to be the change leaders ending HIV. And so building the leadership of Black folks in the HIV field, building the leadership of Black people who are not in the HIV field but have a role to play in our ending this epidemic, and then making sure that we have systems in place that are not replicating institutions and systems of racism that we all do because this is the country that we live in, but rather that we have systems that are intentionally supporting Black leadership in the HIV field. I'm running close to time, so I'm going to breeze through these next couple things. If you're a part of our BTNs, then I've heard a couple places that I know that we have BTNs when we were doing the introductions. But since April, our BTNs have done amazing with pivoting and hosting virtual town halls. So we've had 13 to date. So these are local town halls that take We the People for recommendations, and our local BTNs are tailoring those recommendations for their community and working with their local jurisdictions to include those recommendations in their EHE efforts. And right now, our BTNs are also really focused on voter engagement and mobilization. As you can imagine, we're doing education. So what are the bills? What are the things that we're voting on? Who are the elected officials that are running, and where do they stand with stand on HIV? And we're partnering with some amazing organizations like Positive Women's Network on that. And then also really making sure that our BTNs are engaged in local EHE efforts that are picking back up across the country. We've also, like everybody else, had to pivot because of COVID. And so we've done a lot of collaborations related to this. And so we've been doing a Black people and COVID conversations and collaborations with Multicultural AIDS Coalition, with House of Blonnet, with the Harvard CFAR and Southern AIDS Coalition. And so I think we've been doing those every few weeks, really having extensive conversation around what's happening related to COVID and Black folks. COVID's changed everything. And if our mission is to end HIV, we are not going to be able to end HIV unless we respond to COVID. We also know that, the COVID response is being built on the HIV movement. And with the way that COVID's impacting Black communities, for us at BAI, it's critically important that we are engaged in those conversations. We're also have a partnership with the HIV Vaccine Trials Network and with Treatment Advocacy Group to do information dissemination. We're doing training with our BTN around HIV vaccine research and clinical trials. And now we're also expanding that to the COVID vaccine Trials Network and doing community engagement and information dissemination related to the COVID vaccine. If I don't have a family member I've been able to convince yet to take any kind of COVID vaccine if it were to come out. And so for us, it's important that we're having conversations to make sure there's informed consent. What people decide to do is their decision, absolutely. But it's important that people have all the information to be able to do that. And with medical mistrust in Black communities, it's critically important that we're making sure we're giving accurate information, robust information, scientific information to Black communities so we can make our own decisions and make informed decisions for ourselves. And then we launched this new program called The Blacker the Plan, a virtual speaker series that really is focused on Black America overall. We have a portion of our work that focuses on the HIV workforce and supporting the HIV workforce, and another portion of our work that focuses really pretty explicitly on Black America and talking to Black America to get them mobilized to respond to HIV. And so we're doing that now with a speaker series where we're bringing in people from Black America to have conversations that are relevant to the now of the time, and continuously looping HIV back into what's happening right now. We do lots of training, capacity building. We are piloting an online HIV certification program in 3 places in the South, which I'm really excited about. Hopefully, the plan is we'll launch this out kind of widespread going into 2021. But this is really kind of culturally responsive, making sure that folks have not just the science of HIV, which is important and we provide, but also kind of what are the other things that we need to know about as people in the HIV workforce? What do our allies in the HIV workforce need to know? How do you work with Black folks? What does cultural competency and cultural relevancy mean? What does it mean to be an ally moving into an accomplice role? And so we have a really kind of amazing curriculum, again, with some of the best, smartest Black folks in the field who have developed that content. Oh, relaunch of HIV. That's supposed to say the relaunch of our African American HIV University, which is our flagship training capacity program. And so we're planning on relaunching that in 2021, which we're really excited about, really trying to build capacity, build Black leadership across the country. And then really supporting Black leaders in HIV. And so we have been pulling together Black EDs in the HIV field for the past few months to really try and support our sustainability. COVID's here. We can expect a recession. We can expect there's going to be huge impacts on the sustainability of our organizations. And so making sure that we don't have Black organizations, the people of color organizations are sustained. And so that's something that we're doing. There's a Black kind of specific program that we have, but we've also partnered with Latino Commission on AIDS and San Francisco Community Health Center to do some programming specifically for people of color-led organizations, HIV organizations, and really ensuring our sustainability. I just want to quickly shout out, I'm excited. We are going to be airing in the next few weeks for the Blacker the Plan, a uniquely and unapologetically Black conversation with Dr. Fauci. So really, getting real with him. Black people don't trust none of this stuff. And so, how do we make sure that Black people are engaged? What is the information that we need to know? And also acknowledging, that the experience, what is it that we need to know for people who are living with HIV, and what do we need to know, particularly as a movement that is leading the COVID response? How do we engage with that? And so I'm really excited that I got to do, we did this conversation with 3 of our board members. So Jesse Mylan, who is our board chair emeritus and the CEO of AIDS United, Marlene McNeese, who is the board chair at NASDAQ, and her, I think, full-time paying job is the associate director at the Houston Health Department, and our board chair, Griselle Howard. And the last thing I'm going to close with is it's been an exciting time to see the movement that's happened around equity and Black lives. And as someone who does work in HIV, who, you know, has thought around equity, I personally feel reinvigorated in a way that is different than I've felt over the past 10, 14, or however many years. And there's never been a better time or a more critical time to look at what equity within HIV looks like and doesn't look like. The HIV movement has been critical in finding equity, particularly as it relates to LGBTQ rights. And, you know, there's been so much success in the HIV movement and being able to advocate for community. So many of the changes that we see in health now are because of the advocacy from the 80s and 90s with ACT UP and other folks that have been critical to being able to say that we can potentially end the epidemic 5, 10, you know, within our lifetime. That's never happened before. That's never happened in, you know, when we have a disease or when we have, you know, a virus that enters into our community. It usually takes a huge amount of time for us to be able to end that epidemic or that pandemic. So there's been all this kind of great success, right? And I would say that the HIV movement, you know, values equity, and that, you know, we say, you know, nothing for us without us. But when we look at our institutions, when we look at what I call the HIV industry, right? The people who are leading HIV organizations, the way when we look at pharmaceutical companies, when we look at foundations, when we look at centers for AIDS researchers and AIDS education training centers, the HIV industry in the US is a multi-billion-dollar a year industry that is primarily driven because of Black and brown people who are living with HIV. That's the reality of it, right? But yet, when we look at who are the leaders across the country who are leading these efforts, who are leading organizations with power, who are leading institutions with huge amounts of resources and money, that there's a disparity. And it's understandable, right? We see this all the time. We experience it even at VAI, that, you know, we replicate systems of oppression because that is the way that is kind of our culture and how we live, right? How we do hiring, how we value education and who gets that education. All of these things within their nature, particularly in the systems that we have, are anti-Black. But we have to do something different, right? We have to start holding ourselves accountable in a different kind of way. It's not okay that we have boards, that we have leadership within organizations, we have institutions that have these huge amounts of resources that do not look like the communities that they serve. That, you know, maybe have 1 or 2 Black people, 1 Black person in HR, and that's it. I think that we're not okay. We've never been okay with it. And it feels good to be in a place to say, and we're not going to take it anymore. And, you know, we're going to have some honest conversations around what accountability looks like as it relates to this. You know, part of the reason we may not be seeing some of the progress is because we don't have institutions that are from those communities. And so I think that we are at a defining moment when it comes to HIV, if we're serious about getting to the end of HIV in our lifetime, we're going to have to do some internal reflection. We're going to have to do some critical reflection of ourselves around how we're leading, around who's leading, and make some changes. You know, we don't see trans leadership across the country, and particularly in some of these huge institutions, right? There's amazing trans leadership from community that are leading organizations, particularly their own organizations that, you know, maybe in these various places, but where do we see them on boards? Where do we see them in powers of position that are able to resource power, resource opportunities to create change? And, you know, we're making some movement on it. I think it's exciting, but I think that there's a reckoning coming, and that I'm hoping that we're going to all be able to lean into the discomfort. There's discomfort that I have, there's privileges that I have as a cis, Black, hetero woman. You know, there's so many privileges I have. So what does that mean for me leading an organization? And where do I look at my board and say, okay, these things need to change? Where do I look at my leadership within the organization and say, okay, why don't I have a trans person of leadership on this role? How many people within my executive team are people who are living with HIV? All of these things are critically important if we're talking about equity, if we're talking about dismantling systems. And I'll leave it at that. You know, it's an ongoing process. I'm excited to partner with folks on this. We're working through this in many ways, and hopefully we'll be rolling out some things really soon. But my hope is that, you know, our statements around Black Lives Matter will move from a statement on our website, a statement in an email, to actual systems changes in how we do our work within our organizations and institutions. So that's it. Thank you, Paul, for allowing me to go a little bit over time.
Yay, no, thank you so much. I really appreciate hearing. You know, I think sometimes you don't get to see the breadth and the depth of an institution. And so it was really wonderful to see all the different things that you're doing, and what an important difference that makes. Now, we have a lot of people online right now, and I'm sure that they have a lot of questions. And so what I'd like you to do, people, is in the question section of the GoToWebinar control panel, if you can put your question, but in addition to putting your question, also if you could identify yourself. And so while we're waiting for some questions, I have a couple of my own that I'd like to ask you. You know, we're sitting in this unique, unbelievable moment with the intersection of COVID-19, of Black Lives Matter, and of our efforts to collectively end the epidemic. What do you think the priority should be right now, and what should particularly people working in the community be focusing on?
Yes, absolutely. I mean, I think to me, COVID and EHE, ending the HIV epidemic, go hand in hand. Particularly for Black and Latinx communities, COVID is devastating. And there's no way that we're going to get to the end of HIV unless we can make sure that our Black and Brown communities are protected in the fight against COVID. You know, Black and Brown folks, particularly Latinx communities, you know, they're more likely to be essential workers, more likely to work in places where we don't have as many safety precautions, and we're also more likely to live in intergenerational homes. And so, you know, if we are not responding to those things, there's no way, you know, HIV testing even matters when you are on a ventilator for COVID. I also think it's really important, you know, it's been scary for me personally to see some of our BTAN leaders that have been impacted by COVID, and particularly living with HIV, you know, fighting through that and then being impacted by COVID. How does that happen, right? To be able to kind of live this long, living with HIV, to fight through that, and then to have this impact from COVID. You know, I think they go hand in hand. We also see local health departments that are completely having to shift and change because of COVID. And so many of our EHE or ending the HIV epidemic champions within health departments are now focusing their efforts on ending the HIV epidemic, on COVID. And that for some changing their ability. And so, I think that the COVID work and ending the HIV epidemic goes hand in hand. And I think that, I guess I'm saying they're all the priorities, huh, Paul? That's probably not right. Because I also think, but I think this is part of EHE, right? Trump didn't give us this guide. Well, he gave us the guidance of being innovative within our local efforts to end HIV. But I think part of that has to be really critically looking at our institutions and our systems that are tasked with leading those efforts.
So let me ask, do we have any questions from participants?
We do have a few. So if you can hear me okay?
Yes.
So the first question we have is from Derek Robinson, and he says, do you believe there has been equity for the HIV positive straight Black male? If not, what are the plans to address this matter?
Wow.
Has there been equity? I don't know about equity, but I don't think there's been representation. I don't think that there's been a focus and priority of Black hetero HIV positive men. And I think when you don't do that, then you are also eliminating and deprioritizing Black women, cis and trans, right? Because those are usually our partners. And so yeah, I think that there's a strong kind of segmentation of Black communities that is actually not really how we live our lives, right? We don't really live our lives where it's just, okay, if you're a Black gay man living with HIV, then, you don't integrate, you don't engage, and you aren't influenced by the Black community overall. So yeah, I think that there's definitely not prioritization of it. And I would say my recommendation for how to respond to that is that when we're talking about Black community, or even like subsects of our community, Black MSM, Black trans women, Black cis women, Black hetero men, that you should never do a Black MSM program, for example, that doesn't have some component that's about the Black community overall. And so I think that helps with, if that's the case, then, where is their kind of allyship? Where is their partnership? And then I think that includes Black hetero men, Black hetero men who are living with HIV, that we're too small of a community, we're too integrated as a community to do any kind of program that doesn't have some type of effort that focuses on the community as a whole, or our relationship within the Black community with other subsects of Black community members.
Great, thank you. Next question, Chip.
Sure, we have Carrie from Austin, Texas. Where can we look for updates on the Talk with Dr. Fauci? I don't see it on the website.
Yes, if you sign up for our newsletter, you'll get the email. It'll be in the next few weeks.
So how can they sign up for your newsletter? And Chip, can you make sure to put that in the chat section? So how do they sign up for your newsletter?
I'm going to try and go online and look. But I know if you go to blackaids.org, I think there's something that says sign up or partner with us, that you can get information from us there.
Great. So we'll go to blackaids.org and we'll look for that, everybody. And if you can't find it, someone on BAI staff will send it to Chip and we can post it. Good.
Yeah.
Next question.
This is a follow-up from Derek. Is there any funding for heterosexual Black men in the Ending the Epidemic plan?
There's not specific money for different populations within the federal plan. Paul, tell me if I'm wrong, but there's not specific money for that. It happens at the local level. So your health department, who's already gone through a phase of planning and has a plan in place that they're updating continuously, will be, they are the people, that is the institution that would be able to say, okay, we're going to develop a $150,000 a year grant for local organizations to work specifically with Black hetero men who are living with HIV. So I would say your first or one place to look, and I'm going to tell you probably have to do some advocacy work on this, is with your local health department. I'd recommend seeing who else you can get to partner with you. If you're going to make a demand or a request from your health department, it's going to be powerful if you have X number of Black folks in your community who signed on. It will be more powerful if you have X number of organizations locally that have already kind of signed on board, and then make sure that you have you've done kind of like a mini needs assessment. This is the need within our local community, right? What's the demographic data? How many Black men who are heterosexual are living with HIV each year? Maybe talk to the epidemiologist within your state health department to really come forward with a good plan and say, this is what we're asking for. This is the data, and this is the whole backup of people who are on my side who are saying we should have this. And then I would say the other thing that you can do is obviously go to foundations and kind of like pharma and funders and make your case. But if you invest in developing what your plan is and the data, then you'll have a strong case, I think, in going to funders for the money. But unfortunately, I can't tell you of any funders who have money explicitly for that. And then from the federal government, they don't have designations for who the money goes for locally for kind of target communities.
Thank you. Next question, Chip.
This is Effie from Oakland. How do I get more information on your training?
Go to our website and sign up. We're piloting this online HIV certification program. It's a couple-week program. It's going to be in 3 southern cities. I think we have like 2 cities in Georgia, Arkansas, and a couple other places to kind of make sure the content makes sense. And then we'll be rolling that out in 2021. And then, here goes the top. You want to say hi?
What will you be certified to do?
It's an online training program.
So yes, please introduce somebody there. I know who it is.
Say hi. Say hi to the people. Say hi. Okay. Well, you can't ask me something right now. He's
That was precious. Oh my God, so cute, so cute. So cute.
Work from home, all together.
It's all about realities. So next question.
Sure. This is from Shalonda Kelly, management analyst for HOT. What is data for Black and Latinx LGBTQIA youth? Are they getting tested? Or is it increasing or declining?
Chip, I'm sorry you're breaking up a little bit. Could you repeat that question?
Sure. Sorry. Can you hear me okay now?
Yes.
Okay. This is from Shalonda Kelly. She's a management analyst at the HOT program at HUD. What is data showing for Black and Latinx LGBTQIA youth? Are they getting tested? Are positive results increasing or declining?
Yeah. Are they getting testing? We're better than we've been in the past. We've seen so the number of people who know their HIV status has increased significantly over the past few years, particularly over the past decade. When you then start breaking it up, though, particularly as it relates to LGBTQ people, LGBTQ young people, the data changes a bit. We've seen some improvements, or we've seen increases in testing amongst Black and Latinx MSM. But there's still disparity. We've been able to drop some. We were seeing an increase for many years, and so that increase is not as dramatic anymore. But there's still a lot of work that needs to happen there. We don't have as much data, and maybe Paul, I don't know if you know about this. I don't know about data specifically for lesbians, LGBT, young lesbians, and so I think that's something that we can probably you can add on if you have. But yeah, there's improvements that have happened, but we're still not meeting the national targets for those specific populations, specifically for young people and young LGBTQ people, though we've seen some improvements. And it'll be interesting to see what happens because of COVID. Right, we know that organizations across the country have are either shut down or they're in kind of mitigation mode. Some organizations are open, but the services are very different, right? Most people are doing appointments or, because we have to, make sure there's space between everybody. And I think we're all anticipating that these next rounds of numbers that we see from COVID might change the game a bit, with decreases in testing, decreases in people who are knowing their status, or less people who know their status, and then also challenges for people who are even, young people, LGBTQ people who have been who have fallen out of care because of COVID.
Yeah, no,
Paul, do you want to add to that?
No, well, the only thing I would add to that is that I think, COVID is like everything else, throwing us all in the loop. And right now, we don't have good data on what HIV testing looks like during COVID. What I think is particularly worrisome, though, is without access to testing, what is also HIV transmission like during this time period? And what, obviously, we're all very concerned that we come out of this epidemic with a large number of new people living with HIV. And so time will tell. Chip, next question.
Sure. What role can the advocacy and public health community play in dismantling anti-Black racism in the U.S.?
Oh, so much.
That was a paid question. That was your staffer. I know it was.
There's so much. I think that there's many ways we can hold people accountable, right? So I think that one thing is we're always better in groups. We're always better when we collaborate. We're always better in coalition. And so don't go at it alone. Whether it is, forming a new coalition, whether it's, bolstering a coalition that's already in place, which is something we try and do as much as possible, right? We don't want to always kind of restart things, but make sure you have your crew behind you. And then that there's, so many places to kind of hold folks accountable and kind of point out where there's inequities. I think that, one place that I'm personally focused on is organizations. That's partially because I think of the privilege and the power that I hold. And so trying to really say, okay, who, hey guys, who's on your board? And I think you can do that within your organization. You can do that in other organizations. Who's on your executive leadership team? Usually what we see is this disparity where you have all these frontline staff that are people of color, or people who are living with HIV, and the higher you go up in the organization, the wider that it gets. And so, holding that up and holding that out, I think is really important. I also think that you can think about kind of how do you do advocacy so that we are doing intersectional work, right? HIV is not, is not a disease that lives in isolation. It is, it's about housing, it's about substance use, it's about mental health support, it's about quality access healthcare. And so how can you it's about mass incarceration. So how do you bring all of those things into the work? And so whether it's, getting everybody together, once a quarter, and you find somebody to buy food, to kind of entice people to come in, and so you can brainstorm and think about how we can work together. I think there's a lot of different opportunities to that. Of course, I'd be remiss to say, look at our Black Treatment Advocate Network. If you're in a city that has a BTN, you have a network of folks who are already there, who are doing some of that work. So you can definitely connect in that way. But I think the time is now. We've seen all of these kind of letters, these demand letters, asking for X, Y, Z in equity. And I think that we can do that now. You can do that locally. I'm really all about, getting all these sign-ons, seeing what Black elected officials you have that would be interested, are they running for office right now? Might they be running for office in 2 years? And this is a conversation that we're all having. And so I think you can get a lot more attention for it right now as well. Can you bring some media in? Call your local news station and say, hey, look at this kind of inequity that I'm seeing, and nobody's responded to me. Can you come out and talk to us? And acknowledge that. And so I think those are some of the tools that you can use, but I think the time is now for us to try and move on some of this.
Unfortunately, we're out of time. We have 2 more minutes left. And so what I want to do is give you the last word. But before I do that, I just want to stop and say thank you so much for doing this. This was extraordinarily informative. And I hope that everyone in the audience got to learn it. It's also going to be on the web afterwards. So please, after you sign off of today's webinar, you're going to get an assessment form. I hope you'll fill out that evaluation. It's really important. So Raniyah, you get the last word here.
Thank you so much, Paul. Thank you again for having me. When you sent me a message and said, "Oh, do you want to do this?" I said, "Me? Really?" You've been doing this work for a long time, and so to have your support, and you've always been so supportive. I would email you random things asking you for sponsorships and, letters of support, and you've always been there, and that means a lot to me. And I think, people like you who invest in younger leadership, because I'm not that young, but younger leadership, and Black leadership and women leadership is important. And I hope, my commitment is to continue to pay that forward. And so I just want to extend my gratitude for you and for the way you've shown up. And, I just would encourage folks, the time is now. John Lewis, his passing, the concept of good trouble is something he talks a lot about. And, the HIV field, our movement, our efforts to end HIV, there's no way we're going to do that without getting in some good trouble. And so let's shake it up, let's point it out, let's call it out, and let's do it together. I'm here with you. You got Paul. And so, I'm excited to be able to tell my little one, that when he gets older, that HIV can be something up at the past, that's something that he's not going to have to worry about. And I think the only way we can do that is together. And so I'm grateful for you all joining. Paul, thank you for the invitation.
Thank you. Bye, everybody. We will see you next week. Bye.
Bye.